Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. As we continue through our hypertension week and series, I want to do some more questions, and then we'll start to delve a little bit deeper into the specific medication groups as well this week. But question number one states, a 52-year-old African-American female presents to the office today for her annual wellness exam. She states that her blood pressure has been fluctuating lately. Upon examination today, her blood pressure is 144 over 84. She states that she has been exercising and watching the things that she is consuming. What is the best treatment at this time? Is it A, continue to monitor, patient is healthy and no treatment is warranted? B, continue lifestyle modifications and initiate chlorothalidone? C, continue lifestyle modifications and initiate amlodipine? Or D, initiate lisinopril? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked. So here the stem of the question states, what is the best treatment at this time? And when we're talking treatment, if they're asking you about treatment, look first to see if they have provided you with a diagnosis. And if they have not, then you want to take it a step further and look at the assessment findings, right? So here, um, we are focusing on blood pressure, but it doesn't give you a specific. So you want to kind of work your way through this. So look at those assessment findings. And I tell y'all when we're looking at these assessment findings, also make sure that you pay attention to a few areas: their age, their gender, and their ethnicity, as this can help you to how and what and why we are treating it in a specific fashion, right? So this is a 52-year-old female. She's African American. So we'll store that in our mind. She said her blood pressure has been fluctuating. On exam, it's 144 over 84. So we know no matter if she has a past medical history or not, if you're greater than that 140 over 90 range, we're sitting in that range, we want to start therapy, right? So that 144 is letting us know we need to start doing something. Um, she is already doing the lifestyle modifications. It says that she's exercising, watching the things that she's eating, right? So what is the best treatment at this time? So I want you to walk through, I tell you to think about the starting four. But in this situation, this is an African American female. This is a example of when ethnicity is going to help to show you which path you should take for treatment. For African American population, thiazides, calcium channel blockers are our starting things that we utilize for blood pressure management, right? And so there's nothing showing why we should not give any thiazide. So the best answer is B. Continue the lifestyle modifications and initiate chlorothalidone, okay? Question number 2. A 42-year-old male presents to the office for follow-up. He has a past medical history of hypertension, COPD, and diabetes. He denies any allergies. Upon examination, vital signs are as follows. Blood pressure is 136 over 82. Respirations are 20. Pulse is 82 beats per minute, and the temperature is 98.4. The nurse practitioner inquires about his current medications, and he states that he takes metformin, albuterol, PRN, and states that his lisinopril will stop because of a cough and lip swelling. Based on these findings, how should the nurse practitioner treat? Is it A, initiate lifestyle modifications and chlorothalidone? B, instruct the patient to restart lisinopril? C, initiate ramipril, and D, lifestyle modifications and initiate losartan. Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, based on these findings, how should the nurse practitioner treat? So let's go to the top because we are still talking blood pressure, but we need more details. So this is a 42-year-old male. So we know male and 42. He does have a past medical history, hypertension, COPD, diabetes. We need to keep that in mind. No allergies though. So we want to start to think about blood pressure management for that population. His blood pressure is still elevated. Remember, if they have comorbidities, we do not want it to exceed that 130/90 range. And I know in these past two questions, it's exceeding the systolic numbers, but not the diastolic. You still want to go ahead and treat. I will tell y'all for board purposes, they're going to make sure that it exceeds completely, so there's no question. But I just want to say that so you're not getting confused on this. But blood pressure is 136/82, so it's still exceeding that. He's already having issues with this. He's already been on blood pressure medication, but it has been stopped. So we need to do something to continue to manage him, right? Now, he states that he was stopped on lisinopril because of a cough and angioedema, the lip swelling, right? So here we know that, hey, he's diabetic. So it's a different pathway, right? So we need some renal protection. How do we want to maneuver? This patient has the comorbidities. We want to do renal protection. He cannot have ACEs. So let's go with the ARB. So D, lifestyle modifications, initiate low sartan. Sartan, ARBs and then sartan, right? So you know you can't do the lisinopril because he has angioedema from it. So we don't want to go to another ACE. He's coughing and having angioedema, okay? All right, question number 3. A 56-year-old female presents to the office today for the management of her blood pressure. She denies any past medical history or allergies. Upon examination, her blood pressure is elevated at 142/92. What would be the best first-line therapy at this time? Is it A, to initiate chlorothalidone, B, initiate lisinopril, C, initiate amlodipine, or D, initiate losartan? Take a moment and tell me what you got. All right, so here the stem of the question states, what would be the best first line therapy at this time? So again, not only looking for treatment, but the first line, right? And so it states that blood pressure is elevated at 142/92. Um, so we know that she does definitely need more it warrants medication therapy, right? She came in because she knew that her blood pressure is up and she was looking for management of it. Does not have a past medical history, so this is still exceeding that goal range for healthy people. Does not have any allergies that would prevent us from utilizing any medication. So again, think of your starting four, your thiazides, your ACE, your ARBs, your calcium channel blockers, with thiazides being the captain, the top of that first line therapy option. So we want to go with the thiazide. So A, initiate chlorothalidone would be your best answer, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to that number. And you can also shoot us an email at the nursing studio, the number 1 @gmail.com. The things that I do offer are my review book, ebook, and paperback option is linked in the bio of this channel. My self-paced review for family and adult Gerald is also linked in the bio of this channel. If you're looking to do practice questions, the QBank options are linked in the bio of this channel. And then if you're looking to book any of the one-on-one sessions with me, I always say reach out either by calling, texting, emailing us, as I offer several different tiers of options for one-on-one sessions, but I like to specifically speak with you to gauge what you truly need before moving forward with one of our booking sessions of any of the one-on-one options. So always reach out. But y'all know what to do. Y'all make sure y'all meet me back here. We'll continue our hypertension series. We'll get more into medications this week. But happy studying. Bye, y'all.